how would we know that this is truly a life-threatening situation, if we would know at all?
Well, I think if it's silent,
Yeah.
if when we're dealing with a problem that's discovered and silent, it's a silent problem, then it becomes a risk assessment that your physician has to do. And the way we do that is by looking at the size of the aneurysm and following it over time. We know a lot about the risk of rupture of aneurysms, and the rupture risk goes up as the aneurysm increases in size. Generally that's about 5.5 centimeters or about 2.5 inches in the abdomen, and somewhere around 6 centimeters in the chest area. So there's a difference in the rate of rupture. If an aneurysm is small, while small aneurysms can rupture, the risk is actually very small as well. And so we generally recommend surveillance. Your doctor will recommend a chest x-ray or CAT scan, something like that. So we actually follow these over time. So the two biggest risks of rupture are the absolute size, as the aneurysm gets bigger, and then the rate of growth. If an aneurysm is growing, generally greater than 10% over time, over 1 year, then that increases the rate of rupture as well.
And since you just mentioned rupture, doctor, I want to inform our viewers that if, God forbid, an abdominal aneurysm does rupture, you would feel sudden severe pain in your lower abdomen. Here are some of the signs, doctor: nausea, vomiting, constipation, and problems with urination, clammy, sweaty skin, lightheadedness, a rapid heart rate when standing up. Doctor, would you like to chime in on these?
Yeah, these are all symptoms of something really bad going on in the body.
Yes.
And I think that's really the takeaway. If you experience any of those symptoms, it's really important that you seek medical attention, because it means something is wrong in your body and you need to seek help. And the best place to go is to the nearest emergency room.